Welcome back, folks, and I hope everybody enjoyed their break. I'm glad you're all back with us. Our next keynote address is by Dr. Manal Azzi, who is Senior Occupational Safety and Health Specialist at ILO in Geneva, where she spent the last 17 years. Dr. Azzi leads the ILO's Occupational Safety and Health team and manages the work on chemical safety in the environment, as well as on ILO's activities on non-communicable diseases, health promotion in the workplace, including improved well-being, nutrition, and the prevention of stress, psychosocial risks, violence, and substance abuse in the world of work, which is a mouthful. Manal has prepared a great presentation on managing work-related psychosocial risks during the pandemic and beyond that I know you'll find both enjoyable and informative. Manal, thanks so much for being with us, and the stage is yours.
Hi, so thank you so much, George, for that wonderful introduction. It's a great pleasure to be here and a great pleasure to have everyone on board for such an important event in a historical moment for what concerns health around the world. So it's a pleasure for the International Labour Organization to join all our practitioners, all our experts around the world in this discussion on occupational safety and health, and more specifically on what is waiting for this field and this discipline in the coming future. It's true that this pandemic has changed everything we do in many different ways, some for the positive, although we've been through a lot of struggles, and it's reflected in some sense badly on workplaces. It has changed work arrangements. It has really changed the way we do things. And so from an ILO perspective, I thought it would be interesting to share with everyone some of the research we've been doing, especially on one particular aspect. There is no one around the world that has not been touched by the impact on our mental health that we face during this pandemic. And obviously, working and living through this global health crisis, it's affected different workers in different ways. We have the essential service workers, people who are at the front line. We have the people working from home, people who've lost their jobs. The various insecurities have made it, such a huge burden for us to maintain a psychosocial well-being for us and our families. So I thought that this would be something that we could talk about this today that would be of interest for everyone. A little reminder of who we are. So I'm in the International Labour Organization, which is a UN agency. Our headquarters are based in Geneva, and we have tens and tens of offices around the world in different regions and countries. Our products and publications are translated in numerous languages and are adapted to various contexts around the world. What's interesting about the ILO, the International Labour Organization, is that we are not only governed by our member states, that is our governments, but we also have worker representatives and unions, and we have employers and their organizations that come to the table for every discussion. So mainly all departments of labor, ministries of labor around the world, and employers and workers need to debate on every global convention or standard that we come up with or code of practice. And what we're known for since 1919, even before the UN as we know it today was established, so we were way before that, is that this tripartite structure we have is really essential for social dialogue and for implementing some of the policies and guidance that we promote around the world. And we have a huge normative body. And so that's really our comparative advantage when you look at different agencies. And we have now over 190 conventions. These are international treaties or standards around various issues related to gender, to forced labor, to elimination of child labor, to occupational safety and health across various risks, chemical risks, physical risks, psychosocial risks, and other risks that we are faced with at work. And these standards are negotiated for years. And then when they're adopted and ratified by member states, they become obligatory and binding to these member states, who then translate their provisions into national law. And then national law is implemented according to national legislation and practice, obviously, in every country. So they form a global basis of normative standards that the world looks to. And so we are obviously, well covered in terms of the traditional occupational safety and health risks and hazards. But when it comes to psychosocial risks that all of us face today more than ever, we're still lacking a little bit in some of the conventions we have. So going back into this psychosocial discussion, especially during the COVID-19 pandemic, what really has changed in the past 2 years? And we're seeing, new versions of the virus today. Just when we think we're sort of out of the crisis state, we go back into this crisis situation. And we've realized there's a lot of lack of knowledge and there's a lot of transparency in every step of the way. And I think occupational health service staff and our role in various companies across the world is crucial. First, to demystify some of the misconceptions, maybe around vaccination, maybe around testing, maybe around contact tracing. All of these are different tasks that, have fallen on our desks as occupational health service providers or practitioners. And we need to play that active role, and we need to make that link between public health and occupational health today more than ever. So because of this crisis that we're living, we've seen that people's work arrangements have changed. Working part-time, working flexibly, working from home, working from anywhere is even more of a challenge today. And this poses different psychosocial challenges than we had before. And the rapid spread of the virus itself, has created a lot of fear in people, and fear for going back to their different workplaces where they think, they're fearing contagion. They're fearing, whether the appropriate measures have been put in place to protect them or not. And here's the big question. When you go back to work, what rights do you have? If you feel you are in danger, do you have the right to leave and remove yourself from this danger, this real or perceived danger, without any form of retaliation? Well, that's one of the main provisions of ILO's conventions, is to ensure that workers can remove themselves from hazardous situations without retaliation. And that's where our principles and normative standards come to play, because they need to be respected in different countries with different socioeconomic status around the world. So what is the impact? Why do we speak about these psychosocial risks? And it's always very difficult for people to understand psychosocial risks because it's not something tangible. It's not, a safeguard that we need to put in place or remove. It's not something that's very practical that we can just say we've done or haven't done. The effect and the way the dynamics of how psychosocial risks and their factors are around us is more subtle. Sometimes it's very difficult to see. Sometimes it takes time. And sometimes we only know about it when we hear of the impact on the person that it affects. So the different responses we have to the different stresses at work that keep changing, even more so with the virus, include low motivation, exhaustion, anxiety. So we end up having people present at work, but not really active, and that's what we call presentism, or completely absent from work for different medical reasons. And so once we get to that stage, it's really difficult to rewind back. And that's why the way we look at things and our main approach as occupational health practitioners around the world really is to focus on prevention, is to be able to anticipate and prevent diseases and illnesses and accidents before they actually occur. Because when it comes to depression, for example, once we're suffering from depression, it's difficult to go backwards and not to fall back into that cycle of negative symptoms that we normally face. It's not only psychological, the effect of these various stressors, it's also physical reactions. People suffer from digestive problems. Sometimes it's rashes and dermatological reactions, cardiovascular diseases, musculoskeletal, headaches, migraines, different aches and pains that are sort of inflammatory reactions of our body to what we are facing on a mental space. Increased risk, obviously, when we are under a lot of stress, when we're mentally not well, we are at increased risk of actual physical injuries and accidents due to lack of attention or accuracy in performing the task and jobs that we have to be doing. And all of this obviously impacts productivity. This is where it becomes interesting for businesses, because they're always scared that, this is going to cost me too much money. I'm not going to invest in preventing. I'm not going to invest in insurance. I'm not going to invest in protections. It's okay. High turnover. I lose some workers. I get new workers. But this is where you're losing all your talent. You're losing the skill, the profession, the history, the institutional memory of what you do. And so it is important to invest, because a little investment in preventing these injuries and protecting your workforce will go a long way in improving your productivity sustainably. And so the linkages are quite clear for all of us, and we can't say it enough, because there's still a lot of resistance around the world to invest in something we can't see, and to invest in prevention, something that we don't know the likelihood of it happening or not, although we have an idea of the different estimates and statistics we have. But as long as it's not a short-term impact, it's very difficult for people to plan ahead. Exactly like we are living this pandemic. You can't plan for a crisis in the middle of a crisis. So all the countries or systems that had proper preparedness and emergency plans were able to quickly move and face the crisis head on. And other systems that were, lacking behind just struggled even more to start planning their emergency systems and putting everything in place and identifying the different players and roles, that then the crisis was just too far in for the reaction to take proper place. Obviously, identifying hazards and risks when it comes to psychosocial risks is very different when you're identifying psychosocial factors than when you're identifying a physical risk or a chemical risk, where you're looking at the various chemicals, the storage, the handling, the transport, the exposure, and the flammability or other reactions. When you're looking at psychosocial risks, it's very subtle, and the things we need to be looking for are varied. And the disciplines that need to be doing this, need to collaborate between human resources, between occupational health focal points, social workers, counselors, mediators, however the workforce or workplace is actually organized. So we need to be able to identify the sources of exposure at source, considering all the tasks performed. We need to really understand what are the work activities, what is the nature of work in this enterprise, what is its size, what does it produce, what are the interpersonal relationships like, who manages who, what kind of hierarchy, what kind of gender diversity we have in the workforce. And we identify any hazard that may arise due to WOSH measures even. So especially during the COVID-19 pandemic, when people were asked to wear personal protective equipment, masks all the time, when they had shields between desks or at different places, some of these measures in and within themselves to protect our physical health became burdens in different ways. So we need to be sure that the WOSH measures we actually put in place don't cause an extra suffering. We also need to look at the external factors affecting mental health. And a lot of people ended up going to work in a lot of fear and forced to go to work, or they would lose their job or lose their salaries or lose their daily pay or seasonal work. So a lot of responsibilities were also outside of the workplace increased, where people had domestic responsibilities, either to take care of the elderly, family members, or children, or spouses, etc. So those were, all of these factors were affecting our mental well-being. And we need to keep thinking about new ways that we can detect hazards for workers that are working from home. And different questionnaires were developed, and different ways, and phone calls and ways to reach people were developed. But it always has to be really sensitive, because people are already dealing with a lot in this crisis and in the changes that they were facing. Again, we don't like to focus on individual characteristics of people, but we have to consider some individual differences between workers when we associate risks and how people react and interact with each other and with various exposures that they face. So some of the safety and health measures that we can take to prevent psychosocial risks is obviously to adapt to the hazards and risks that we find. So we need to make the assessments adapted to the different hazards we find. But it's not just finding a certain hazard and then, stopping there. We need to completely continue to review and modify on a regular basis, because risks keep changing, because sometimes modalities of work and production processes change. We also need to be very aware of the national legislation in our country and look around us to see what is good practice and how other companies or sectors or economic activities are functioning. And here, there's a huge difference between formal work and informal work that already comes with its certain less protections and more insecurities, obviously, with the informal work. We need to keep up to date. Safety and health in general is a science. It keeps changing, it evolves, especially in times of crisis. Ways to mitigate the impact keeps evolving. More information about the virus comes out daily, about the ways to also prevent and decrease the impact comes out and changes daily between information on vaccination, information how the virus is spread. It really kept changing. So we cannot be, rigid in our ways, but really open to understand the novelties around these various exposures. And most importantly, and what makes this platform different than other platforms, is the necessity to keep workers engaged and to have them participate at all phases of the process. So it's not just about developing a policy top down and saying this is how we need to be doing things. We need to really make sure that workers are on the table in consulting, even as we develop policy, as we develop regulation, because at the end of the day, they're the ones that know best their work areas and work practices, but also they're the ones who are going to have to implement, adopt certain behaviors, and believe in the changes that we are hoping that they will abide by. So for consultation has been key. We've noticed that in many countries around the world where workers have played an important role, either bilaterally at workplaces themselves with the employers and managers, or either tripartitely at the national level through WorkLife committees, tripartite committees plus, we've noticed that the changes were more effective and the proposals were more realistic. So the needs were identified at an early stage, and the policies and guidance that were put in place actually met the actual needs that were voiced by the workers themselves. So when we're talking about psychosocial risks, we're obviously talking about many areas of action. And one of them that we always forget is obviously looking at the environment and equipment. And here we're going to go through a little bit the different areas, including workload, work pace, work schedule, the issue of violence harassment, which we faced a lot during the virus and during this pandemic, the concern with managing our personal lives and our workspaces, people losing their job and job security questions. What kind of managers do we have, and what kind of leadership that we have in the different work places also played an important role in managing psychosocial risks. The way we communicate, the way we share information, the level of transparency, the level of independence and resources that we give our workers also plays an important role when we're facing these changes. Another proactive role is the issue that workplaces are not just made for workers to just come home as they left, but it's also an opportunity to promote health. This is where we reach a large proportion of people. This is where people spend most of their days. So promoting healthy practices and trying to navigate the possible negative coping behaviors from smoking, alcohol abuse, drug abuse that people tend to revert to in times of crisis is also a job that we can take up in different workplaces. ensuring social support, understanding people's dynamics, if they're working, close to their family community, or if they're working remotely, if they're expats working in different countries altogether. Understanding how this pandemic has affected the social support network is really important, because that is an area that can provide a lot of solutions and really prevent some of the unnecessary stressors that workers were facing during this pandemic. And obviously psychological support. If it's smaller companies, we're not asking to have a full-on, medical officer or or a psychologist on site, but it's about having that workplace play an important role in referring people to different places they can go to for psychological support. As many people during this phase were also facing a lot of domestic violence, having to be in the same home. This exacerbated existing issues that, families were facing. And so they needed an external or third party to intervene. And the workplace can understand, listen, and help refer people to such support when the workplace becomes the home and the home becomes the workplace. It's important to face that. So when it comes to environments and equipment, during the COVID-19 crisis, we saw that workers faced a lot more anxiety and stress because of their working environment. We saw, especially the health service sector, nurses and doctors, medical doctors and physicians, obviously had to stay on the front line. We're trying to manage and tend to patients, but they had still little knowledge on the exact transmission details of the virus, and they had no equipment. There were not only personal protective equipment for themselves, but also equipment to help the patients, the ventilators, the beds, everything they needed to actually provide for good care was lacking at different points and different stages of this outbreak. So the lack of equipment causes an extra stress for workers, which is, mental stress. There was a huge fear of getting infected at work, especially, frontliners and people who had to deal with dead bodies due to the virus, laboratories, emergency deliveries, all the other public services that needed to keep going, even in the middle of a lockdown phase. And this lack of clarity on what are the good practices to limit exposure to coronavirus, especially in the beginning, was also an added stress for many people, this lack of knowledge. And there was a huge shortage. We remember very well the shortage in appropriate masks for appropriate professions. And a lot of them had to use really heavy personal protective equipment that left its own physical marks on hands, the gloves worn all day that weren't necessarily of great quality, the masks, the face shields, the various tools, and sometimes it was full clothing for protections were not necessarily the most comfortable and had their own physical and dermatological negative impacts on the people using them. And also the lack of tools. So for people who suddenly were sent home to continue to work from home, either they didn't have the right computers, chairs, desks, the right setup in terms of ventilation, lighting. So we don't, if teleworking was planned, you have time to set up a certain workspace that's ergonomically fit for you. But when it's forced, immediate, and through emergency, a lot of people didn't have the right tools. They needed maybe to write long documents with inappropriate tools, or sit for long hours, or work longer hours. And so not having the right equipment was a huge issue that is an added stress to people. Some suggestions, obviously, is to adopt proper engineering controls and some administrative measures, even when we're at the workplace, for ensuring physical distance, promoting proper hygiene, disinfecting, and improving ventilation in workplaces. We also need to provide, whenever possible, the appropriate personal protective equipment, and also not to necessarily overburden people with the overuse of personal protective equipment when we have shields that can be put in place, proper physical distancing, proper ventilation, or other means that can complement these preventative measures so that people don't need to be wearing unnecessarily a lot of PPEs for longer periods of time. We need to provide, to the extent possible, the right equipment and tools for people to be able to perform their job, and practical guidance on how to actually set up your home space or workspace at home or in different places that can be suitable to accomplish your specific task. We need not forget, obviously, the special needs of people with disabilities in this new working environment. The other point I wanted to mention is the issue of workload, workspace, and work schedule. But more than that, it's also the resources we give our workers. If we ask workers to work long hours, but they're doing something that they have control of, that they're given the right resources to do, sometimes it's enjoyable, and it's not necessarily something that would lead to a burnout or would exhaust them. But sometimes when we're asking people to work long hours, not giving them the right time to do the work, the right information to do the work, or the right financial resources or other support they may need, then it becomes giving more than they have. And that's where the balance of, effort and reward also is tipped. And so the issue of workload and work pace and work schedule are very important, and people's control over them is important. So they're able to space out how they need to deliver on certain projects and jobs. And we've seen that people who are given that independence to organize their time with clear output, with clear job tasks, and with clear resources to support the delivery of the work is accomplished better, and the person feels much better and much more motivated and engaged. And here we see, a lot of people, especially those working in essential delivery and transportation of security, transportation of goods, and people working in security and safety, people working in cleaning, during the first phases, especially of the virus, faced huge stressors. And if one of them fell sick, another person needed to take on the load of the other person. So the issue of overloading people with work or underloading other people with work are both sources of stress for workers. And some suggested actions are actually assessing the workload and really listening to your workers and what is the capacity that they have. And is there a chance to redistribute work assignments so that not one person, just because they deliver good work, is tasked with everything at the same time? We need to clearly review and define tasks and responsibilities and see what results can be achieved. We need to improve working methods and ensure that the necessary equipment is given to people. Another important factor, especially during this pandemic when people are working from everywhere, is to always make sure we're acknowledging and appreciating workers' efforts when they're coping with these changes and coping with various responsibilities. Starting and finishing times sometimes could be an idea to be flexible. You arrange work schedules to avoid people working long hours, and that they have enough time to recuperate when they have done a long shift, that they're able to recuperate, including breaks, enough breaks for people to have to also compensate for the overwork that they may have done, and different exercises or advice that we can provide for people to really decompress in those break sessions. Another important area, as I mentioned earlier, is violence and harassment. And we saw that people were going into supermarkets fighting for products. People didn't know, when was the next time that they could actually leave their homes during lockdowns. So cashiers, people selling products, the lack of products in the various grocery stores led to different situations of harassment, of violence, from clients to service providers, but also from patients to healthcare workers. And in some countries, we notice a lot of homicides and deaths and murders due to people who felt that they were not treated fairly, people who did not have access to care or did not have access to essential goods. So a lot of that led to a lot of violence between a lot of people. And this is not to mention the ongoing, cases of violence and harassment that occur regardless of the pandemic that we are going through. And that's why the ILO 2 years ago developed an international convention on violence and harassment in the world of work. It's the first convention of its kind in the world, focused for the world of work, and really identifies violence and harassment as a range of unacceptable behaviors that can happen once or repeatedly, and that can be intentional or unintentional, but has a really negative impact, be it on the physical, psychological, or sexual health of the alleged victim. So this international convention really fills a huge gap in the world on identifying and defining what violence and harassment in the world of work is, and ways to prevent and integrate prevention into ongoing safety and health management systems or others. Here are some suggestions for violence and harassment. The necessity to have a workplace policy so that people, know what is required of them and actually abide by it. Sometimes some administrative measures on how we organize performance appraisals or promotions, etc., are really important to have a social, like a just organization and organizational behavior that seems fair for everyone. This regular consultations with workers and representatives where they exist is really important to address different signs of violence and harassment at early stages, and provide people and workers with clear instructions on how to diffuse hostile situations, especially, if you're working with really expensive material, if you're working at night, if you're facing many clients, if you're having to travel for work. So there are different circumstances where we are faced with a higher risk of violence and harassment. And there are different techniques that can be, workers can be trained to better manage the situations that we can't avoid. Establishing proper procedures is important, and abiding by them, because if we want to encourage an environment where people freely report abuse or violation of these policies to protect them from violence and harassment, we need to make sure that when this happens, their privacy and confidentiality is respected, but also action is taken against the alleged perpetrator, so that people have a reason to report and feel that something has changed, and know they're not, unfairly dismissed if they're having to voice their concerns or of being at the receiving end of harassment or violence. So that's an important issue that we could talk about for hours, but it was important for me to mention it as part of these psychosocial factors that the world is facing today, especially the world of work. Work-life balance. So this cannot be stressed more. It was already a huge issue, this care economy, this invisible work that people do at home, and then the paid work that they do in their workspaces. And now, as workers work from everywhere, from coffee shops, from public workspaces, from their homes, from airplanes, the line is even more blurred, obviously, between when is a work time and when is this time that we can actually dedicate taking care of family members or doing whatever we feel like doing. So COVID-19 made it worse, obviously, for a lot of people around the world. Schools, were closed. Parents had to, especially maybe single parents, had even more burden to just school their kids from home while as they work at the same time, competing for, information technology tools and appliances in the same home. And so there were no boundaries. And this creates an overwhelming stress for people to continuously juggle between their responsibilities at home and their responsibilities to deliver a good quality work. And this is, there are solutions, there are ways that we can help people juggle these situations. A really interesting one that some big companies, who have some resources were able to do is that was really helpful and practical, was to offer paid vouchers, for example, for babysitting services where that was possible, because for some time even that was not possible because people were in complete lockdown. But that's a practical. So, for a working mother, for example, it doesn't help that somebody says, take a yoga class or do some meditation. It helps much more to give a practical solution, such as a paid babysitter for an hour or two, so one can focus on work or other, or attend to other business. So there were some companies who took this initiative, and a lot of flexibility is required, because at the end of the day, we need to focus on the output, the job. It doesn't matter if people are at their desk from 8 to 6, if they're, half the time daydreaming. It's about how efficient is their work, and is it done in hours that are suitable for them to have, flexibility to juggle responsibilities for drop off, pickups, medical emergencies or appointments, etc., but be able to deliver their work. For some people, having a moment in the evening after 8, this is when they actually are the most productive. Others, it's at 5 a.m. before official work hours start. And because from 8 to 10 a.m., maybe they have other things that they need to attend to. So allowing that level of flexibility is a win-win situation for everyone. And we shouldn't be stuck in the old ways of working hours and working time, as long as it's flexible and adapted to what makes people more engaged and productive. Job security was a huge concern, obviously, during the pandemic. Many people were very unlucky, lost their jobs, or were on standby, waiting to see if they will lose their jobs. And that is, the way it was. It was a burden for employers as well, who found their businesses being, going bankrupt. People changed professions a lot. Sectors were completely, had lost all hope that they would be, a necessity in the future, especially in terms of tourism, hotel, restaurants. A lot of the workers, really decided to, go and do different trainings and change their specializations and professions because of this pandemic. And this is even more of an issue for workers that already have different vulnerabilities, such as people that are disabled, young workers who are just entering the workforce during this pandemic, gig workers who already face a lot of informality and lack of protection, and other casual workers, etc. So job security obviously was a source of concern that affected people's mental health. And there were, in terms of solutions, governments that actually took this up and managed to find ways that they can support and reorganize and redirect budgets to support clearly with certain schemes and avoiding the unfair dismissal of workers. And we always needed to remind workers that they have the right to leave. They have a right to sick leave. It's not because you went on COVID-19 sick leave for 10 or 20 days that you should come back and found you have no job left. And these are issues that people need to be reminded. And that's why we work on national legislation, and we work on making sure that that is enforced and people are compliant with these protective measures, because they are what's helpful in the long run to protect our workforce. Here are some various examples, obviously, on how we can encourage workers to speak up, explore different options with governments to implement support for businesses so businesses can actually survive and be sustainable through such a crisis. And then to help people skill and reskill themselves to continue to be useful in a way and to continue to have a place in the workforce. Management leadership played a huge role. We can see from our own organizations where we have managers that were really flexible, that really continue to communicate with people, to be as transparent as possible. Obviously, we didn't have all the answers we needed, but being as transparent as possible really helps. So today, this is where we're at. This is what we're thinking. Maybe in a month, there could be a return to the office, maybe not. It could be rotational, it could be not. Consulting, sharing our various ideas is really important so that workers are not kept in the dark and they have a sense of time and planning and belonging. When managers, themselves also set a good example so that they're not, I'm an overworking manager. I work 20 hours a day and I expect the same of my people. That doesn't set a good example. The manager needs to also, play by the rules and lead by example, obviously. And workers can feel that. They can feel if the manager really believes in what they're saying and actually rewards people who take care of their health or looks at that as something, as an accessory, or actually believes that is part and parcel of delivering a good job. So management leadership and various kinds were really important. And some suggestions really were, like I mentioned, is to really show workers that you're giving their safety a priority. And it's really not just by saying it, but really prioritizing and showing the various measures that your workplaces are taking to help them. Pandemic can be seen as an opportunity. It's an experience to set up some of these positive changes that we keep talking about. And to slowly move your companies into a preparedness stage where we want to be ready. We want to be ready for different phases of the current pandemic, but for any other global crisis that we will face, especially a health crisis. We want to continue to be role models as managers, and we want to just be as clear and transparent with our workers and to hear them out and to see what solutions work best for them and try to adapt to those particular needs. As long as, at the end of the day, we want people to continue to work, because once you have half your workforce on absenteeism, presentism, medical leave, or burnout, that's, a lose-lose situation for everyone. Communication, information, and training. So obviously, extensive media coverage of the epidemic created so many concerns and so many misconceptions and so much information that people could not, didn't know who to follow, what to understand. And so the workplace can play a role in cleaning up all of that influx of information and trying to be a leader in explaining to their workers, in referring them to reliable resources and references and sources of information, to appease some of the worry and anxiety that was going on and still is around the world. And so giving people training on all of the aspects that we discussed are really important from all levels. And we found that was really relevant, especially during the pandemic. We need to be really clear and be specific. We can't give mixed messages, be ambiguous, especially when people are facing so much ambiguity as we face a global health crisis. We need to make sure that people feel comfortable to be honest and communicate and speak about their personal lives. And this is a time where personal life is not separate from a work life. And the more you avoid listening to people's issues, the more it's going to just blow up in your face, especially during this global crisis that has not spared anyone. One wonderful example from where we work is when the virus was at its peak here in Geneva, it was announced that director level workers, managers needed to come to the office and everyone else needs to work from home. for somehow it was sort of a message saying, yeah, so directors are immune to the virus and so need to be in the office and other people need to be protected at home. So all of this mixed messaging is not acceptable. So we are all equal in the face of a pandemic. We are all predisposed. We are all exposed to this risk that we need to contain. And the best way to do that is to eliminate or to be as less exposed as possible. And that applies to all workers, be they managers, employers, or frontline workers or others. So we need to be clear, what messages, and we need to be coherent and consistent with what we're telling people, and treat people fairly and as equally as possible, and ensure that everybody has access to the information that we are providing. So some suggestions for communication, information, and training is obviously to train managers and supervisors to act as role models, but also to teach them calming skills and maintenance of the different rhythms of the body. So there are different ways that we can train people, including on their nutrition and exercise, in ways to recognize if they see that some workers are facing, are going through a form of depression, to train people on working from home and the different ergonomic or psychosocial risks that they may face. And it was a new thing for everyone. Managers were trying to say, okay, how do I manage people remotely? How do I keep in contact but not bother their personal space? How many meetings should I have? What is virtual, exhaustion from virtual meetings and exchanges? And where does their privacy start and end in a workday that does not happen from a workplace designated to be a workplace? A really important point is this one really on health promotion and prevention of negative coping behaviors. So we notice a lot of people there, resorted to some of their bad habits: overeating, undereating, not exercising, irregular patterns of sleep due to certain questions, fears, anxieties, increased alcohol consumption by lockdown, sitting at home, unable to interact, unable to have a social life. Some people resorted to, increased smoking, drugs, and all sorts of poor habits. And this is where, the workplace can play an important role in encouraging people to improve their behaviors, in providing different solutions and different trainings, in giving them the time to do the various activities that we are trying to promote, in encouraging people to go and seek counseling, seek support if they're facing a habit that they can't really get rid of. So there are different ways that we need to be aware and promote health. Even if everything's going well, we need to be proactive in promoting health at work, wherever that work is. Social support, like I said, for many people, they were really either isolated in their homes or isolated from families because families lived overseas or different states or different regions. And so it was really difficult to be facing a pandemic with this physical isolation. And whatever we can provide from the workspace, from our colleagues, or having informal get-togethers virtually or other, continue to be important, so people can continue to have that compass of stability, mental stability, emotional stability, and social stability. And here were some suggestions that we were providing for people to assist in maintaining this social support, continuing to recognize people's good performance, making sure we voice that, making sure we express how important people are to the team, how important they are to the work process and to the company as a whole. And, that because we weren't, and maybe, in the near future won't be able to interact in a natural way face-to-face a lot of the time, we need to be creative and make sure we do that differently as well, but continue to provide that sense of reassurance and interpersonal interaction. Psychological support. Obviously, we're talking about mental health today. We're talking about this huge, pandemic, parallel to the health pandemic, the pandemic itself due to the virus. This mental health pandemic across the world, where people have lost their sense of direction for so many justifiable reasons. Where we saw that where workplaces had a good psychological support system in place with different, some people had online chat system with psychologists available for their workers, where people can express their worries and concerns. They were heard, they were advised, they were listened to. This helped a lot in maintaining a healthy workforce. And here are some suggestions, of course, to better integrate these psychological initiatives into your workplace COVID-19 response plans, creating what we call a buddy system to monitor burnout or stress, paying also attention to people who already had mental health concerns before the COVID-19. So those were people that were more at risk of being highly affected by such the measures taken to combat COVID-19, including lockdown and physical distancing and other. So maintaining confidentiality about some of these services provided to individual workers. We really encourage workers to come out and be comfortable to speak up and feel that they are heard and they are valuable within their organizations, and their organization is doing everything it can to keep them, to recognize them, and to make sure that that work remains meaningful, because that is at the end of the day what we are aiming to do for sustainable workforce or productivity. We need to make sure that what we do is meaningful for everyone in different ways, so that everyone has a reason to be active and engaged and in good health as they perform the various tasks required of them. So that was just a brief overview of some of the psychosocial factors that we were going through in the world of work. It's unfortunate that we can't meet face to face, but hopefully very soon. I will leave you with some of our publications of this past biennium, and there will be many more when you go visit us online. And these are some of them that we developed to help companies of all sizes around the world to really be able to return to work or manage work during this global health crisis. Thank you again. Here are my contact details. Happy to hear from you. I hope you enjoy the rest of the sessions. It was a great honor to join you here today. Thank you.